Welcome to Nasdaq Trade Talks. I'm Jill Malandrino, Global Markets Reporter at Nasdaq. Joining us is Virgilio Gibbon. He's the CEO of Afya. We're going to learn about the leading medical education group in Brazil and its efforts facing the COVID-19 pandemic. Virgilio, thank you so much for joining us. Welcome to Trade Talks. Tell us a bit about Afya.
Well, thank you. Thank you for the opportunity talking about Afya. So we are today the largest medical education group in Brazil, and serving every stage of one single career. In our case, is the physicians. We start our relationship in the first step in the undergrad medical programs in Brazil, pathing through the residence prep courses, and also all the medical education, the continuing medical education programs that we offer to fulfill all the requirements for these professionals for their entire journey, for their entire career. As a unique approach, we are also using technology to leverage the quality of our programs, of our services. We are capturing data since the beginning to individualize their learning process and to create a completely different learning experience for all students and physicians that are engaged in one of our programs. So this is kind of our mission, our different approach for other education groups here.
And Virgilio, tell us about the online solutions that the company launched to help professionals during the COVID-19 pandemic.
Yes, we are the largest medical, the largest prep course for residency in Brazil. We prepare this platform also to offer for undergrad programs. Today, every single student in our platform, in our campuses, are using this platform, and also we decide after the pandemic situation to launch our platform. It's without any cost for public and also private schools, the medical schools, to help them to keep the learning process active during all the crisis here. This is very important to keep the contact between the professors, that they are physicians with their students, and also they are inviting the last year students to enroll to face the COVID-19 crisis. So it's very important to have all the information to keep the learning process active, making the link between physicians, professors, and the students that are concluding the program. So this is very important in terms of social impact. And besides that, we are also helping all the hospital partners that we have. We have more than 60 hospitals that we are having our practice of our institutions here in Brazil, and also helping them with donation to have all the individual equipment to protect them from all the COVID crisis. So that's the type of initiative that we start doing back in April. And also we are launching a series of webinars to explain physicians and also students how to face COVID crisis now that they are in the middle of the crisis, in the front, treating people and trying to dilute this curve, minimizing the impact for all the society here in Brazil.
And you've also done a wonderful job paying tributes to healthcare workers, to teachers, really the people who are on the front line helping to fight the COVID-19 pandemic. Tell us about the tributes that you've been paying to healthcare workers and teachers.
So the first thing was how we could change so fast our operation to keep the learning process active, training our professors, and also adapting our operation to keep we have today more than 30,000 students studying our platform. They were 100% on campus, and since 15th of March, we are operating 100% online. So that was a huge impact in terms of capacitation, how we are training our professors, how we adapt our students for the learning process, how they are going to face all this. And besides all of that, the psychology side, how we are explaining all the situation for our employees, for our professors, and also for our students that are very anxious, how we are going to resume our practical classes, our on-campus activities. They are missing all the content that's also required during the learning process. But that was I think the wonderful job that we had to do 5, 6 weeks ago to change our platform and explain professors and students how to operate during the circumstances, the pandemic.
And Virgilio, to wrap up here, post-COVID-19, when we're on the other side of this, how do you think it will look for your industry? Do you think we'll continue to operate more from a work-from-home online environment than we did before?
This is, I was talking with Anna here. We changed in the last 5 weeks more than the last 50 years. So we have all cooperative activities running perfect well on distance. We have the home office. Less than 5% of all cooperative activities are now being centralized in the headquarters. Everyone is working from their home, and a perfect performance in terms of transactions and how we are supporting our operation. And 35,000 students, 5,000 employees, professors giving their lectures, their class from their home. This is completely different. We could imagine that in so short period of time we could change the entire industry, not only in Brazil, but the entire all countries that I'm having a conversation to understand the impact. So in terms of medical school, the impact not only in the learning process, but also the telemedicine that we are seeing, how we are treating patients, how we are making the diagnosis using all the distance environment. This is completely different for the labor market, and also we have to update all the curriculums, all the learning, the content using this new technology to prepare the new physicians for the new world. So the future is already happened. Telemedicine, online distance for medical school, online content, how to prepare professors and students to get prepared for all this kind of environment in the medical programs. It's even more important. So huge change. And as we have all the technology accent in our operation since the beginning, I think we are in a very good position to keep updating and leading all this innovation technology approach in medical education in Brazil.
Yeah, that's an excellent point you made. We certainly have changed more in 5 weeks than we have in 50 years. Thank you so much for joining us and sharing Afya's story.
Okay, thank you. It's my pleasure. Bye-bye.
Thank you. And thanks for joining me. I'm Jill Malandrino, Global Markets Reporter at Nasdaq.